Coronavirus has had a devastating impact on the delivery of sexual reproductive health services and the ability of the lesbian, gay, bisexual, transgender, and intersex community to access them. Members of the LGBTI community who spoke to Amakhosikazi Media on condition of anonymity said COVID-19 had further contributed to their marginalization, especially in terms of sexual reproductive health rights. They said the ongoing lockdown has made it difficult for them as an already marginalized community to access health services at public health centers, since their referral centers are centralized in the central business district and their movements are restricted. The LGBTI community said members are also subjected to domestic violence and have nowhere to go since their movements are restricted.
Stay-at-home restrictions have had most LGBTI persons confined in environments that are hostile or unsupportive. So we have a lot of LGBTI persons who are facing domestic violence and abuse at this time of COVID-19 lockdown. When we get to a point of total acceptance of people and respect of human rights of all, I'm sure the needs and wants of the LGBTI community would have been realized then, as it is all anchored upon violation of human rights. Access to health service before lockdown was difficult, as LGBTI people have been discriminated and stigmatized, and no one thought they deserved the health services like everyone else. And before lockdown, most LGBTI serving organizations have bridged the gap by being able to connect LGBTI people to healthcare centers where they can get access to SRHR services and all the other health services that they would need. Now come to access to health services during lockdown. We already have places where LGBTI people are supposed to go to access their health care services and all their health needs to be attended to. But now we have issues of transport from point A to point B, and the other challenges of how safe are people, the LGBTI people, when they are going to access their health services.
Sibusiso Pepe, the executive director of Dot Youth Zimbabwe, an organization that focuses on issues affecting children, adolescent girls and young women, said transgender and intersex members face the highest discrimination. He said the LGBTI members also face discrimination from the public in transport queues, which discourages them from attempting to go to their referral centers where they can access health services without being judged. Pepe said lack of access to sexual health services may lead to health risks and recommended that health service providers should intensify service delivery and serve everyone equally.
Due to the restricted movement, this has affected their access to services, specifically for the trans and intersex. These ones face the highest risk of discrimination and victimization due to their gender markers. As such, they tend to shun away from services because of the mode of transport that's used now. Zupco, the buses, the queues. The LGBTI are then put at a risk of more discrimination, victimization, and even attacks by the public while they are in the long queue. The local clinics do not provide LGBTI friendly services, or we do not have LGBTI friendly service provision centers, which poses a number of health risks, including STIs and HIV infection. I think service providers must intensify different service delivery models, providing clients with treatment or medication for longer periods so that they do not have to be moving around seeking the services, and also intensify outreach models that offer SRHR to key populations in the areas of comfort, and scale up engagement through social media.
Despite efforts by a number of organizations to include the LGBTI community in various sectors, the community still faces challenges in accessing health services due to discrimination and victimization. Nyaradzo Bakari reporting for Amakhosikazi Media.